Good afternoon. I hope we are all doing well. Today we are going to have baby examination, and the need for baby examination is very, very crucial because after the baby has passed through all the processes of delivery and has come out, the midwife should also examine the baby to find out any abnormalities, any congenital deformities, that is, baby born with abnormalities from birth. All right, and so it is necessary, and it also helps us to check the neurological functionings of this baby, so that early identification of problems can be handled, and then the way out, family and the parents are brought in to help the mother and the baby, and then help the baby to come out successfully to live his or her normal life. So baby examination is very crucial to the midwife to rule out all these abnormalities that I've already mentioned. And so all babies that are born need to be examined. In fact, we have the initial examination of the baby and then the subsequent ones. Initially, when the baby comes out, the first thing to do, or initial or immediate examination of the baby, the first thing to do is to clean the eyes the moment this baby's head is seen at the vulva, so that the baby will not take any infection from the delivery grounds to inherit. And so immediately what is done is to clean the eyes to set the baby free. Then after the baby has come out, the midwife would have to dry the baby off the liquor, and then put the baby on the mother's abdomen for at least 1 hour, and a new sheet is placed together with the mother, so that this baby would have the warmth from the mother, and then the bonding of the mother and the baby begins from this stage, where the mother will be helped to hold the baby to prevent the baby from falling. Now, after 1 hour, where the mother has rested, in fact, depending on the condition of the mother and then of the baby, whilst they have rested for this 1 hour, then after 1 hour, this baby is taken from the mother and then examined from head to toe. And so, immediate examination, you examine the baby from head to toe to identify any problems, any abnormalities that are seen. Then subsequently, that will be after 6 hours. If the protocol of the hospital demands that this baby be bathed, yes, this baby will be bathed. Afterwards, before the mother and the baby are discharged home, another examination is done to identify any problem which wasn't identified at the immediate examination of the newborn. Okay, and so these are things that are done by the midwife to help this baby live a normal life, to help the mother also to enjoy having a newborn into the family. And so basically, this is what we're going to do. So, Auntie Ansah, I am student midwife. I am a midwife, Owusu Ansah, who is here this afternoon to examine your baby from head to toe after you have rested at least for 6 hours. Any problem that I seen or identified, I'll communicate everything to you, and then we see the way forward. I hope that I'm permitted to do that.
Yes.
Thank you very much. So I'll place the baby just beside you at the bed here. After everything, I'll come back and give you any information. I appreciate so much for your cooperation. Thank you. In preparing for examination of the newborn, this baby is taken from the mother with permission granted by her. And then the baby is placed on a flat surface, a flat, smooth surface. And so baby Mary is placed on this and making sure that the baby is well protected. Then I wash my hands and so I've washed my hands. My tray is already set, and on the tray I have my cotton swab soaked with warm water to clean the ice of any discharge or anything that is seen. All right. And I have my thermometer to check for the temperature of the baby. All right. I have my gloves because it's a newborn baby. The diaper to change if what the baby is wearing is wet. I have the cord clamps. This one is used to reclamp if on observation the cord is bleeding. Reclamp the cord. I have my stethoscope to also listen to the chest and the tape measure to check for the head circumference, chest, and then the full length of the baby. So immediately before I unwrap this baby, I'll close the nearby windows and then draw the curtains to prevent the baby from chills. After that, I'll still have to wash my hands before I will unwrap this baby. And so I remove the cap, then observe the head for swellings, sutures, scratches, rashes, and cuts on the head. Swellings, it could be caput succedaneum, which is seen at birth. But Kefa hematoma appears 24 hours after birth. All right. And so we look at the coronal sutures, the anterior fontanelle or the bregma, the parietal bones, the sagittal suture, and the occipital, the lambdoidal, which has the lambdoidal suture. And so on the head, basically there are no swellings, no scratches, no rashes, and no cuts. So far there is no bleeding on the head of the baby. And so once the head is free from all these things, the cap is placed back to prevent hypothermia. Yes. Okay. So having finished, I'll take, let me wear the gloves. And then so I clean the eye from inside out, from the inner contours to the outer, and then I repeat the other eye. Okay. So then I run my hand from the outer contours of the eye to the ear insertion to see if it's in line. Sometimes the ear is low set, so you see that the pinna is very low, and that may give a clue or an indication that this baby is having Down syndrome, which is trisomy 13 abnormality of the chromosomes. All right. Then I run my hand on the nasal septum to see if the bridge there is any fracture, or and the nostrils. So I tilt the head up a little to be able to look through the nostril to see if there is any blockage in the nose. Then I press the lower eyelid and then the upper eyelid downwards, upwards here to view the eye so that I can see if there is any abnormality like red eyes, squint, or cataract, congenital cataract. Or sometimes the baby's eye socket is empty, and so it's always needful. Some of the babies would open their eyes, others will close their eyes, so we have to be mindful of that, always trying to open the eye for observation before we continue. Now I come to the mouth, where I try to place my little finger into the mouth to see. So the suckling reflex is active. This baby is trying to suckle my little finger, and there is no abnormality in the mouth. With the mouth, the shape is round, and there is nothing like hair lips, cleft palate or cleft lip, or any false tooth in the mouth. The tongue too is not, there is no tongue tie, which is an abnormality viewed when it is examined. So when I'm done, I will expose the baby, look at the baby, so a quick observation on the color of the baby, the activity, then I'll cover, and then as and whenever I reach, I will expose that particular area, and then I will examine. And so I bring the two hands up, and then I try to bring the hands together for equality. There is no shortness, the hands are equal. Okay, so then I'll examine one after the other. So I hold it for, if there is pain, this baby will give a sharp cry, and so there is no fracture whatsoever. With the palms, we have the palmar creases well lined up, and the fingers are 5. There is no abnormality, and the Capillary refill is fine. There is no abnormalities seen. So I do say with the left. Okay. And so with this one, I try to hold, and this baby, the grasping reflex is also active because the baby is able to hold my hand. All right. And I turn. The palmar creases are all there. The fingers are 5. There is no extra digits over there. And the capillary refill is also fine. All right, having finished, I'll come to the neck to palpate for any swelling, any growth, congenital goiter. No, there is nothing there. When I come to the chest, and try to palpate the breast for any swelling. There is no swelling over here. So I'll listen to the chest. All right. So at this juncture, I'll clean the thermometer, and then I place it in the armpit for 2 minutes. All right. Once it is done, okay, so then I will examine the abdomen I'll palpate the abdomen for tenderness. And also observe the cord for bleeding. So there is no bleeding. It's so regular. And the cord is also healthy and clean. So when I reach the lower extremities, I check for equality, and then I will touch the femur, tibia, fibula for any pain, and then the plantar creases are also well marked out. But the toes 1, 2, 3, 4 are webbed together, so there is an abnormality here on the left leg. I do the same to the right leg. Yes, plantar creases are also well marked out. And the congenital abnormality, that is webbed toes, are also here. So with the 2 legs, the toes are webbed together. All right. So after everything, I'll communicate the findings to the mother. Now, with it's a male, and so I want to identify or locate the urethral meatus. So I hold the penis pull the prepuce backwards or the foreskin backwards to identify the opening of the urethra. It is centrally situated. Sometimes there may be abnormalities where there will be epispadia or hypospadia. The opening may be seen up on the penis or below, and so the urine will be leaking whilst this baby is urinating. Then I'll hold the scrotum to feel for the scrotal sac, and then feel for the testes. So the testes are all there. So it goes like this. You press it inwards and then you palpate. So the testes are all descended. Now I will want to examine the head of the femur for any dislocation, and so it goes in and out. So you flex the knee, so it goes like this, flex the knee, and then it will go like this, go like this, go. So if there is any dislocation, this baby will cry, give a very sharp cry. With this one, baby didn't cry. It tells us that there is no dislocation or any abnormality at the hip joint. Now this baby is turned to the back to examine. Okay, so I will observe there for any rashes or swelling, and so then I'll pass my hand at the spinal cord for any abnormality. Sometimes some of the vertebrae will be missing. You may also see dislocation of the spinal cord or fracture of the cord. And so these are some of the abnormalities which we will discuss further when we meet on the same note. And so these are some of the abnormalities that we want to. Spinal bifida may be there, which may be occluded. You may see some dimples around, which is also an abnormality. Sometimes there may be hairs around the spinal area, which is also an abnormality that may be seen. And so we take note of all these things, and then after everything we write down our notes. We may refer baby to the right cortex if any abnormality is seen, or we may just give the baby to the mother because no abnormalities was seen. And so the cord, as I said, there was no bleeding, nothing was wrong with this baby. So after I'm done, I would like to check the length of this baby. The full length goes this way. So from the occiput, side of the occiput, okay, it's placed there, and then it crosses and come to the knee. Then I stretch it to the heel, to identify. So the full length is 42. Then we also check for the head circumference, which is also important. That is 34. And then the chest circumference, which also It's necessary. Okay. Okay. $28. So basically, then I asked the mother whether baby has passed stools, but she doesn't know whether this baby has passed too. So I want to examine, and so you can use cotton to clean. So as I've done, I use the cotton to clean the anal region to see if the area, the cotton will be soaked with, or if the cotton will pick any greenish stool or meconium from the anus. So it did not. But then I will encourage the woman to observe the baby for any passage of meconium. And so after everything, I place the diaper back, and then I'll wear and dress this baby nicely and give the baby back to the mother to breastfeed. And my identification of the web toes will be communicated to her so that she will notice it. I'll show it to the mother, and then once it's noticed, so I guess we change. Okay. Mary, thank you very much. I'm done with the examination. Your baby is very fine, and I noticed that the feet is webbed together. So I just want to show it's not any harmful thing. It can be taken proper care. It can be taken care of. So we'll show it to the pediatric doctor to see, and then refer the baby to the appropriate quarters where we will take care, and then you may go home and come back for the doctors to do what they have to do for you. I hope that it will not worry you so much. This baby is ready to suckle, so and you give the breast milk to the baby to suckle milk. Baby is doing very, very well. Okay, good. So I'm going to pack my things and then write down whatever I've done for you. Okay. Thank you.